Hello, everyone, and thank you for joining us on the Trucking Tower podcast today for this segment of Executive Insights. With me today is Dr. Mark Manera. Hello, Dr. Manera. How are you?
Good. How are you doing? Thank you so much for having me on.
I'm so excited to talk to you about a very, very important topic, the health and wellness of our truck drivers today.
Yeah, it's a topic that needs to be talked about more in the industry, and unfortunately, it's one that is talked about from January 1st to January 31st, and then gets swept under the rug just like New Year's resolutions do. So I'm excited, and I appreciate you inviting me on.
Yeah, when I saw what you were doing, I was like, we have to have you on our podcast because I want people to know more about what you're doing. You are a doctor of physical therapy. You are the founder of the Trucking Fitness Company and the host of the Merging Lanes podcast. So you have a lot going on in the trucking industry.
Yeah, I do. And it's exciting. And so when I got started with all of this, I don't have like a lot of people in the industry, generations of, family that was in trucking. So one of the big things, as I got started with the Trucking Fitness Company was I need to be a part of the culture and a part of the industry. And that's why I think the podcast and just having conversations with, people like yourself just helps me grow and become more a part of the trucking industry instead of just, hey, that fitness guy.
Right. Well, what brought you to the trucking industry?
Yeah, so I was like you said, I'm a doctor of physical therapy, and I was actually treating patients in a outpatient clinic, physical therapy clinic in Southern Missouri. I live in St. Louis, and I had the opportunity to rehab a ton of drivers. And honestly, that was one of the first experiences I had seeing firsthand the struggles that drivers go through on a day-to-day basis. And I was shocked, inspired by a couple of the people, just kind of how much they sacrifice. And it was this was also like at the start of the pandemic where drivers were kind of one of the heroes with healthcare workers, as hey, they're keeping our economy running. And right. I was listening to the day-to-day life and just seeing how much sacrifice some of these drivers are going through on a day-to-day basis. And then, as a physical therapist and, a little bit of a research nerd, I go and I look at some of the statistics and the research on drivers' health, because, I was seeing in the clinic, and just from, the outside perspective looking in, I knew truck drivers were not the healthiest people in the world. But, as I dug deeper into the research, I saw the statistics, and you've got, when you look at North America as a whole, you've got 4 million people who wake up every day and drive a truck for a living, and 85% of them are overweight. 1 in every 7 suffers from type 2 diabetes. And the kicker, and the one that really inspired me to start the Trucking Fitness Company, was that as a whole, truck drivers have a life expectancy 16 years less than the average population.
That makes me very sad to hear that.
Yeah. And you've got these people who are sacrificing, their day-to-day life just being a driver, and then they finally get to enjoy the fruits of their labor, and then they get 16 years chopped off the back end. And I just, deep down in my core, believe no one's career should define their health. And so and I think trucking, it goes into that. I don't think it has to, but I think that there's just so many barriers and specific constraints that drivers go through on a day-to-day basis that it's just easier to say, screw it, I'm a driver, I can't do anything about it. And I think that's why we see some of those statistics.
Do you think that schedule and just the amount of work that they have to do contributes to that, or why do you think it gets to this place?
Well, I always tell drivers, you can't get down on yourself for the fact that you have to drive and sit behind the wheel for 11 hours. Is it the most ideal situation in the world? No, but that's how you that's how you keep a roof over your head and, food on your kid's plate. But what I do think is that I think they've got unique barriers that are specific to, a driver specifically, that we don't have to face, working a 9-to-5 job, and, a lot of us working from home or going to an office, and then being able to come home to, all the resources in the world, and specifically the over-the-road drivers. And, I think that's where a lot of the mindset that I've seen for drivers is that because of those specific barriers, it's easier for them just to say, I can't do anything about it. I look at the truck stops. I don't really have a lot of people that I can model after saying, well, hey, this person's doing a great job or they're figuring it out. And it's just become an industry-wide problem where, well, it's part of the job description, right? I can't do anything about my health.
Well, and they're kind of alone. They're individually running, right? So you're kind of self-disciplined, or you're on your own in essence. I get that. What are some of the success tips that you would recommend or share with our audience today?
Yeah, I mean, from the trucking company perspective, I think that like I said, I got into this saying, hey, I'm doing this for the drivers. But as I got deeper into the industry, I started to realize, well, everyone wins if drivers are healthier. There's a lot of companies that are, from a retention standpoint, from a work comp or health insurance claims perspective, from a just culture and, drivers having a happy and being happy at their company are losing money. There's things like medical claims that from an injury that are very easy to see, but then there's other things of like, the drivers thinking that their company doesn't care about them or isn't really thinking about them as an actual human. And it's sad to think about, but I've had drivers who told me that they don't feel that way towards their company, or their company doesn't feel like they're thinking about them. And so, I think for a lot of my first success thing would just telling trucking companies to, provide resources to your drivers. Health and wellness is one of the big things, especially when you're thinking about quality of life and how can we improve the quality of life of drivers. Well, if their health is going down the drain, a lot of other aspects, including mental health, including, happiness and other aspects of, them enjoying their lifestyle, which if they enjoy their lifestyle, they stay at your company longer, contributes to, are they staying healthy? Are they able to have these types of resources?
So you've touched on retention of good drivers. You've touched on successful responsiveness and delivery, as well as, the bottom line, bringing in the revenue and keeping it consistent. So yeah, those are really important tips there. What about pitfalls? Anything you would share, your top 3 pitfalls to avoid?
Yeah, I think from a company standpoint, that the number one is that, a large percentage of trucking companies do not offer any health and wellness to programs or just information to their drivers. And so the first one would be offering something. And, the other thing where I find a lot of companies go wrong is they offer something, but it's not built for drivers. They take this cookie cutter program that's built for an office worker and implement it into for their drivers. And that's what I feel like has given a real sour taste in a lot of companies' mouth, is because, well, there's a reason why you don't have high participation rates in these types of programs. And there's a reason why there's not a lot of success for the drivers, is because it's not built for them. And it's not sustainable for them with the resources and the things that they have available to them out on the road. I think that's a big problem. And then the final pitfall that I feel like a lot of companies do is, if they offer it, is kind of dipping their toes in the water instead of going all in and saying, hey, sending an email out about this new wellness program is not going to, make a huge impact on your company, but it really needs to be incorporated into the culture and to the communication of, how you're communicating to your drivers, the culture of, hey, we're X company drivers, we're healthy, and just changing that identity.
Right. And I would imagine that'd be great for PR for a company.
Totally.
To shift that. And then you start to really attract, some really strong, career drivers that way, and it is connecting the company to the driver, and I saw some of the things that you were sharing, the tips, they're just practical and they matter to the driver. And I thought that was really wonderful that you do that.
Yeah, I'm 100% focused on action-based advice. I think education is really important, but for drivers where it is, there's a time constraint and they've got maybe 5 minutes here, 10 minutes there, sending them a huge PDF where they're going down into the biology of how all they're in the physiology of their body. it might be super interesting and really important for some drivers, but the bigger thing for another driver is, hey, you're at McDonald's, instead of getting the Big Mac, get this option instead. And giving them really fast, actionable advice. And then also on the exercise standpoint, something they can do in their truck, out of their truck, or even at home. And, our mantra that we say is, hey, we want to give your drivers and anyone out there the ability to open our app and do it anywhere at any time, because that's,
that I love the fact that you're meeting them where they're at, and you're giving them the quick reference and guidance. So you're really doing it for the company. You're providing it all for the company, where they can just sort of plug and play this into their manual, or their maybe even their training.
Yeah, well, and that's exactly what it is, because these companies, especially especially now with the craziness of trying to recruit more drivers and trying to figure out your whole fleet, you've got enough on your hands. And when you try to continue to juggle another thing of a wellness program, where I know there's a lot of people who are very educated in wellness and health and wellness, but it's just another thing that is easily dropped. And if you don't have someone who is every single week, every single day being able to put energy towards that, it's not going to be able to reap the benefits that you're wanting to. And that's possible if you put time and energy and resources into the health of your fleet.
Well, you're an incredible value add for this industry, and I find you very relatable and very easy to understand, and you communicate very well to the end user, and that's really important here. So how can people get in touch with you if they want to reach out to you about your programs?
I really appreciate that. And if anyone wants to reach out, they can find us at the Trucking Fitness Company at any social media, or I'm on LinkedIn, Mark Manera, and you can also send me an email, mark@truckingfit.com. So truckingfit.com.
Okay, great. So are there any other tips that you would like to share? Any other words of wisdom that you'd like to share for us?
Yeah, I would just say, if you're a company out there who's been thinking about health and wellness, unfortunately, it's not one of those things that's a dire need of, it's the top of your, so it's going to be a top of list thing. And if you, time out, let's repeat that. Sorry, I apologize.
Okay.
Okay, sorry. Can you re-ask the question, and then I'll
Sure. Just final words of wisdom that you have for us, whether it be drivers or companies, anything that you'd like to share with us that would be just some extra.
Yeah. If you're a company out there, you look at your fleet, think about the drivers in your fleet from a personal level, on an individual level, and just, thinking about the impact that having a healthier driver behind the wheel can have on your company's image, your company's bottom line, and your company's relationship with that driver. And I really think more companies need to start pushing health and wellness of drivers, because retention is the new recruiting. And if we just keep this revolving door of drivers leaving and new drivers coming in, that eventually soaks up, and we start losing that recruiting pool.
Well, I would imagine from a company perspective, the cost of bringing on a new driver has a cost to it, right? And if you have to do that more often than the retention of keeping good people, then I would imagine that hits the bottom line as well. So this program sounds like it would keep more and more drivers in the company seat with you, all the while helping them to improve and actually improve performance ultimately too. This is just a win-win-win situation to involve what you're doing. That's my opinion. So
yeah, healthier drivers are safer drivers. They're more energized and show up to work more often, and they're less likely to be injured on the job. And they're also more likely to pass their DOT with flying colors. And I think there's just a huge pile of opportunity that companies are not taking advantage of, thinking about their drivers' health.
Well, listen, I want to talk to you again sometime. I enjoyed today. Thank you for what you're doing. And we will hopefully have you back again soon. And Again, everyone have a great day. And thank you, Dr. Manera, for joining me.
Yeah, thank you for having me on.
Take care.